It's 7:30 on a Thursday morning in Springfield. The lobby and emergency room at the McKenzie-Willamette Medical Center are deserted, all except for room 16, the designated safe room where the drunk and the high can come down slowly. This morning's occupant, a 72-year-old man, intoxicated, depressed, and exhausted. He has almost surely been here before.
A lot of times we will see people come in, sometimes weekly, daily, with the same problems, and their life's getting worse and worse. It's hard to watch them deteriorate.
Mick Kerrigan has been on the battle lines of substance abuse for 35 years. As the emergency room manager here, the registered nurse has seen thousands of people just like the man in room 16. In fact, elderly patients are one of the fastest growing populations of those with substance abuse problems, many of them addicted to pain medications.
But we also see people that come in that have been addicted for years and they're only 12, 13 years old.
Kerrigan says in the old days their motto was simply treat and street, patching people up and sending them on their way. It was an approach that didn't work very well.
Because we're just perpetuating the disease.
So now the motto is treat and rehabilitate. It doesn't rhyme, but it does work. The key is making sure that patients get the social services they need to stop the revolving door. For his efforts on the front lines, on Wednesday, Kerrigan will receive a Community Service Award from Serenity Lane, one of Eugene's leading treatment centers. At its annual foundation breakfast, Serenity Lane will recognize 6 professionals across the area who contribute to the treatment of alcohol and drug addiction.
Identify people who are important in the addiction field that are helping people and not getting the recognition maybe they usually should get.
Dr. Ronald Schwerzler, the medical director of Serenity Lane, says people like Kerrigan play a crucial role in addiction medicine. He wishes there were more cooperation between treatment centers and other health organizations.
I think all private and nonprofit and every health plan should get together and try to treat the addict as best we can.
Schwerzler, who himself has been in recovery for 17 years, says addiction has always been with us, but the drugs are shifting and the patients getting younger.
And what I've seen now, heroin addiction has entered our teens and our 20s in this state. When I came here, I would have nobody in residential that was addicted to heroin. Now I have about 20.
Back in the ER, the man in room 16 is almost ready to leave. The staff will try to find him a bed in a treatment center, but only if his insurance will pay. No matter what, the room will not stay empty long.
It's not a disease that just touches one age or one type of person. It touches everybody.
In Springfield, Bob Shaper, KEZI 9 News.